Hello, my name is Dr. Joseph Giordano. I'm Professor Chairman, Department of Surgery at George Washington University Medical Center. I'd like to tell you about a unique opportunity for surgeons and a surgical team to provide desperately needed care to indigent people living in Guatemala. Over the next 5 minutes, you will see a description of that care and also learn about the impact that care has not only on the people of Guatemala, but also on the volunteers providing the care.
Centro de Salud Bárbara is a full-time clinic located in San Juan Zacatepeques in the western highlands of Guatemala, 1 hour northwest of Guatemala City. The clinic's surgical center is dedicated exclusively to making major medical care available to the most impoverished rural Guatemalans. Partner for Surgery is a nonprofit organization committed to facilitating surgical care for underserved Guatemalans and eliminating the barriers to access. Working in close collaboration, the two organizations have developed a model of delivering surgical care that combines the talents and resources of Guatemalan and North American volunteers. The premise of the model is that good health is a prerequisite for equitable economic development. The clinic environment is clean, orderly, and smoke-free. It is constructed, arranged, and maintained to ensure maximum team efficiency, as well as patient comfort and safety. The premises are contained on one floor with easy access between patient admissions, pre-op, operating rooms, post-op recovery, and patient ward. The operating suite has 2 fully equipped rooms, made possible by a grant from the Rotary Clubs of McLean, Virginia and Parham, Minnesota. Major on-site equipment includes anesthesia machines, laparoscopic towers, autoclaves, and backup generators. Diagnostic capabilities include X-ray, ultrasound, ECG, and standard laboratory testing. A surgical team has the option of bringing their own biomedical technician or contracting with one in Guatemala. The clinic offers on-premises sleeping accommodations if a volunteer needs or chooses to spend the night.
The facilities are outstanding. Again, you always have to be ready to adapt to things that are slightly different than what you have, but they've made them nice here, so there's very little adaptation in terms of the facilities. We have 2 large operating rooms, large enough for a team. Plus, we had medical students and Guatemalan nursing students and a lot of other observers that were maybe in the room at the same time. We didn't feel cramped. It's excellent, it's clean. Good sterilizing facilities. They have outstanding facilities for the patients. In the past, we've had the patients stay in a church with dirt floor perhaps, maybe cots. Here they have an outstanding concrete building with a formal kitchen, excellent washing facilities, nice bunk beds for them, and so they had it very nice, I think. And that's if we think about it being all about the patient, it definitely is here. Patients we are trying to serve, I would say, are generally the poorest of the poor. People that are disenfranchised even in their own country. People that are quite poor, maybe haven't seen a doctor except to do the triage out at the where they get evaluated first in the field, basically. Some of them have seen doctors. I don't mean that none of them have, but a lot of them, doctors are kind of a strange thing and a mystery, and we scare them to some degree. But they're extremely grateful for all we do for them, and as I said, they're the neediest of the needy. But the more you come, the more you can do. We're planning and hoping to do laparoscopic surgery next time, gallbladders and the like. There's certainly a large need for that. We've had, on previous teams, we've had gynecologists. There's a large need for facial plastic surgeons doing cleft lip, cleft palate work and that kind of thing. It's absolutely necessary to take that step, to stop thinking about doing it and actually do it. Now, nobody's helped by you thinking about doing it.
In some ways it's different, and in a lot of ways it's because of how well the clinic's been equipped, it's comparable to the sort of places we work at in Canada. Certainly the population that we've been operating on this last week is different. They're certainly much poorer, and the conditions that they come in with are far more advanced when we see them here than we would see them in Canada. That's probably the biggest difference. We saw this place first. We've been here maybe 3 times over the last couple of years, looking at it, thinking what we could do, how we could equip it, how we could make it work. And when we first came here, this operating room, the 2 rooms, they were just a shell. No lights, no ceilings, no power outlets. And we came back, we thought we had a lot of potential. When we came back to Canada, we drew up a plan of how we thought it might work, and other people from Project Hands, Andrew Ray, particularly our treasurer, sent down some ideas as to how we think it would be done, and basically everything's been done. We now have a fabulous facility. It's clean, we've got the ceilings lowered so they're washable, there's air conditioning, they're a great size, and the equipment, as you can see behind me, these machines are in service in Canada, in clinics where I work. We've got laparoscopy equipment that we're just getting the final touches done, so that can be done. It's clean, it's great. It's actually a good experience to come out here, and I'd recommend it for anybody. When you come here and you see the sort of conditions that people live in and the medical conditions they have that they live with for years in discomfort and pain, and then you compare that with what we see back in Canada and the US, the conditions they have here are far more advanced. They would have been attended to far earlier in North America, whereas here you see a far more severe form of the same conditions. So it kind of opens your eyes to how other people live, and it's very gratifying to be able to help them. And they in turn are very pleased with that someone has taken the trouble to do this for them. Most of these patients haven't had surgery either because they can't afford it. Even just the cost of coming to the doctor and getting some pills is prohibitive for some patients. So having an operation in Guatemala if you have no money you just can't do it. Some are very scared, but as we've worked with patients and they've gone back to their villages and they've said, look, I had this big hernia, now it's gone, it's easy, go and do it. And that sort of multiplies and more patients come in. I'd say come and do it. This is a great place to work. I've worked in worse places in Canada. It's well equipped, you'll have a great time here. And when you get a whole group of people coming down, doctors, nurses for the PACU and the OR, and everybody else who helps out, it's a really great social event as well. So it's good fun.
We had no idea what to expect, what we would find here, and everything was prepared really beautifully for us. And Compañero en Salud had brought the patients. The patients were comfortable in the albergue. The clinic was nice and clean and prepared for us. All the equipment had been unpacked from the container. And we were very, very, very touched as how well everything had been prepared for us here. I think it is an absolutely wonderful experience. I've been working in Guatemala for several years now, and to me it is an extremely uplifting experience. It's a lot of work, it's quite intensive, but the rewards for me are absolutely phenomenal, and I've heard that from everybody else who comes on a trip. There are very few people who come down to Guatemala who don't walk away with having had some kind of a really quite almost spiritual experience. And so I think this is something that I would recommend to everybody to do. I think it's just a very great experience. It's a great privilege to be able to work with the people that we work, with Compañero en Salud and with the gerentes of Compañero en Salud, who are very strong, largely women, incredible personalities, incredibly helpful, and all the patients, they're just wonderful people. And for me, yes, it's a very wonderful experience to come down here.
Yeah, and this is actually my 7th trip here to Guatemala on a medical mission, and because I love the Mayan people that are here. They're so patient and soft-spoken and humble, but very gracious, and doesn't matter what we do, anything we do for them, they are so grateful for.
Our recovery room area where I was, there's 4 beds. It was really well set up. Staff was all wonderful. We were able to integrate ourselves with Guatemalan staff, and The ward where I was beautiful, clean, lots of space, and very easy to organize yourself.
Partner for Surgery's Guatemalan affiliate arranges all in-country logistics, including transportation, convenient accommodations, meals, and Spanish and Mayan language translators. Partner for Surgery also brings pre-screened patients from the remotest areas of the country, where surgical care is completely inaccessible.
Our mandate is to work with the poorest segment of the Guatemalan population. We do not have the means to find those patients to go out into the rural communities. So it's very important for us to have an organization like Partner for Surgery who does exactly that. They bridge that gap for us. Partner for Surgery is a very special organization. They are the link between us and the people out in the rural communities. The local area managers that they use are the ones that go out into these rural communities and they gain the trust of the people. So if they weren't there, then I think a large proportion of these people would never ever have any surgery at all. They would not seek surgery, they would not even know that there was any surgery there, they would not have access to surgery. We want to go to Guatemala and help the Guatemalan people, and there's no way that we could do this without the help of Partner for Surgery.
A team must be capable of organizing their own personnel, including surgeons, anesthesiologists, nurses, and sterilizing technician. With advanced preparation, supplemental local nursing support can be arranged. The team is also responsible for procuring and bringing surgical supplies and collaborating with the clinic on procedures and protocols.
El impacto que tiene esta misión, este proyecto, podríamos decirle, en las comunidades es que cambia vidas realmente porque la gente necesita de trabajar y muchos por el dolor no pueden trabajar, entonces lo que quieren ellos, trabajar bien, no sentir dolor. Entonces ha cambiado vidas en las personas, no solo la persona que es operada, sino que la familia completa.
Kuitaraj enkasha tawli chut compañero de salud chandra jiru naqtatruq chishjib ankila chakila la anja.
Ma hokara sendo porque nakingara sulat linskara sa hulak sa mintanamit ma para tintaus kita singiding ulat porque sa hulak kana hokanak sin salarin.
Ella dice de que le agradece a Compañero en Salud porque por medio de ellos va a poder ayudar a su hijo. Sin la ayuda de Compañero en Salud, ella no pudiera hacer nada y les agradece por haber llegado a su comunidad.
Well, you've seen the video. You see what we do here in the clinic. If you are a director or a member of a surgical team, please consider joining Partner for Surgery to become involved in this wonderful effort.